Hi, it's Sonia. So this is going to be a hip release video, but I do need to talk a little bit of anatomy with you because then once you know why you're doing what you're doing, I think you're gonna do it a little better. So if you have SI joint pain, so the pain in the lower back, you do have dimples there. So you have your spine and then you have your pelvis, but your pelvis is actually two separate pieces. So where your spine and your pelvis meet is called your SI joint. So where your spine is in relation, so your spine could be too arched, it could be too curled in relation to your pelvis, and nerves prefer a certain relationship, and everyone's relationship in body is different. Each pelvis could be, one pelvis could be uneven also. Or one could be rotated forward or back, or one up, one down. I mean, it's really interesting, all the patterns that you can have happen between the pelvis and the spine. Now we add a leg bone to the pelvis, so that comes in here. So some muscles connect the femur bone, the thigh bone, to the pelvis. Some connect the pelvis to the spine. Some rotate the leg out. Some rotate the leg in. Some lift the leg forward. Some pull the leg back. Some hike the hip up. Some tuck the pelvis back. Some tilt the pelvis forward. So this is what abdominals and hip muscles and glute muscles, they're all meeting here. So when you feel a pain in your SI joint or in your lower back, is it your legs being too strong and overactive, attaching to the pelvis, pulling the pelvis around? And that's a lot of times what I see. Then the spine is just kind of left there vulnerable, but the leg muscles are so strong getting pulled around. If your nerve starts to get irritated, it's going to let you know. When you don't listen to it, it's gonna poke a little bit more. So is your legs too overactive? Something isn't getting used enough, something's being used too much. Now, if you work with someone one-on-one and they can see this all, this is great, but it's really hard to feel, and I can't even see it in myself. I'm probably a disaster when I move, but I love the Yamuna ball. There's also Miracle balls. There's also other grocery store balls. I wouldn't recommend doing this with a tennis ball. This surprisingly gets in deeper than a tennis ball or a lacrosse ball. Those just get so hard into the nerves. And although you're feeling it in the nerve, what I'm trying to do is change your fascia pattern, because your fascia pattern is causing a muscle pattern. And then that muscle pattern is what's pulling bones around. So this overemphasis of being too strong, if you're a more sensitive, injured person, getting stronger could actually be what's setting you back. I plant these seeds. Go ahead and do what you want to do, but just know where to come find this in order to manage it. So all of this, I'm going to do one side, and then you're just going to have to either replay it to do the other side or not. And if there's any bad pain, I mean, it's really hard to teach people online and kind of know what's good pain and bad pain. I would say just stay away from all pain. Back off, go more subtle. You can always send me a message and, I can help you. So you're gonna lie on your side. Some people like to be up. I kind of like to be a little lazy. So you're just putting it on your hip bone here. The top of my hip is here, and I'm just gonna move around, and you're going to feel where is the most tender, and then you want to hold and sink into it. You do get a little anatomy lesson on your own. So I'm coming up, I'm more on my pelvis right now. This is my gluteus medius and minimus. This seems to really inhibit, which means to stop your butt from working. When your butt doesn't work, your hamstrings are going to overact. When your hamstrings are too strong and overactive, a lot of times they tilt the pelvis back. And then there's your sciatic nerve, and it doesn't like that. So we want the glute to be the glute, the hamstring to be the hamstring, and then have the rotation come from the butt muscles, not from like the IT band. Yeah, so I'm kind of coming back a little bit more, I'm readjusting, and then just trying to sink down into it. Now I know if it's my hip, because if I rotate my leg up and down, but I'm not moving, I can feel that change. I might need to scoot up a little bit. Inhale and exhale. Now what's interesting, you might start to feel, although you feel your back hurting, this is the muscle that's causing the pelvis to move. So you're gonna start to release tension, calm your nervous system. then you might be able to feel tightness. You might be able to feel tension coming in, and then how that then leads to a patterning of the bones moving, and then your nerves to be kind of under attack. And I'm holding and I'm sinking into it. Yeah, so I lifted my leg a little bit to sink down. Then I'm gonna scoot up a little bit more, kind of come to the back side a little bit more. You know, nothing much here. I twist out a little bit more. So I'm rolling the back side of my butt. It's called the piriformis right now. It connects the sacrum, which is right above your tailbone, to your leg. It rotates the legs in and out, or it tilts your pelvis back. So if you get that sciatic nerve pain, this is what you should be doing with this ball, not a tennis ball, not a lacrosse ball. You could cause a lot more damage and inflammation with that. That short-term relief might be at the long-term expense. So, and then inhale and down, and then exhale and up. All right, so now I'm gonna use this. So there's your hip bone. You have 4 quad muscles, that's why, hence the quad, but that bone, the hip bone, is the attachment to them. This tends to be overactive. Sometimes your quads tend to be overactive. Sometimes releasing here might release your knee because there's only length. Length can pull your kneecap in and cause pain. Length can cause your hip to hike up. So I'm gonna come just on the side of this hip flexor. That's what I'm doing down here. So I'm kind of backing up a little bit. It's kind of a balance challenge. And I'm just gonna hold and sink down into it. As I release, I might need to kind of readjust and lengthen out. And then, you know, if I had a tail, kind of like I'm a dog, or, you know, I do have a tailbone, so I can kind of wag it forward and back, and then just hold and sink into here. Are you holding unconscious tension, and can you let that release? Maybe just try 3 breaths, and with each exhale, just release a little bit more. So if you're someone who tends to sit a lot, or someone who tends to walk a lot, this is really important to do. So it's unfortunate that it's both sides of, if you're, you know, good at sitting or good at walking, but this is why I love the ball, as it addresses it all. It changes the brain to fascia to muscle connection to then, we can then do a strengthening program to hold the release in order to then change our body to feel better. But we're letting the nervous system lead. We're letting it calm down. So now what I'm gonna do is keep this leg here, and I'm gonna twist up and then twist down, because it's a different pull of the fascia. Right now my leg is fixed and my pelvis is rotating in relation to the pelvis. Here was my pelvis staying and my leg rotating. So muscle fascia, you know, if a muscle's here, the fascia can pull it this way more, or it can pull it this way more. It doesn't necessarily mean you pull equally from each side. This is why there's a rise of ligament and tendon injury. This is the stuff you can do years and decades before to prevent a hip replacement. I've seen the people who get hip replacements. I see the patterning they're in. I see the patterning to kind of change it years before it starts to really be bone on bone, and you start to get into your cartilage and wear away and get more arthritis, but it can be hard to reverse. So it just depends if you're someone who has the accountability to kind of do this on your own. So just checking in all of this. I'm gonna end up kind of more on my back, shifting around. I might move it around a little bit. So that's just one hip. You can go on the other hip. You'll start to figure out the difference between the two. What is pain? What is a little bit unusual pain, and maybe a little bit more than tightness? Especially if you have fibromyalgia or an autoimmune. I mean, if you don't have the best mattress and you have like hip pain on the side, if you're using your IT band too much, release your butt. Releasing your butt might help your back. When my SI joint really hurts to the point like it's burning, it's usually in my hip. It's usually my right hip and also the right sciatic, but it's not always. Sometimes my left side starts to act all wonky. So if your hips are a little uneven and you feel pain in one side more than the other, if you look at your bone alignment, it's there, it's telling you what to do. You just have to know how to interpret it. And then here's the Yamuna ball. I've tried other balls, I just really prefer this one. I don't get anything from you going on Amazon or YamunaBodyRolling.com and getting this. The Miracle Balls are really hard to find and they're a little softer. These I just really love, and I haven't found something cheaper for better. And so it just depends what you have. Use what you have first. I mean, if worst case, I guess maybe like ball a pair of socks up, or maybe like roll up a towel or something like that and create something like this and then hold and sink, but that doesn't have give like a ball. So let me know if you have any questions, and hope this helps your hips.